What is going on? Welcome back to ednews.com. We have a lot of good updates coming out of the Wall Street Journal. And what we're seeing here is this one's about anxiety. When should we test anxiety in students? The mental health crisis that's been exacerbated due to the pandemic. So let's kind of dive into this article. It's very different than the other things we talked about today, but it's important as we see what this looks like for families and schools. So let's dive in. So children as young as 8 should be screened for anxiety, experts recommend. Draft guidance underscores pandemic's toll on adolescents' mental health. So if you kind of look at the core of the article, all children should be screened for anxiety starting as young as 8 years old, government-backed experts recommended, providing fresh guidance as doctors and parents warn of worsening mental health crisis among young people in the pandemic. The draft's guidance marks the first time the U.S. Preventive Services Task Force had made recommendations on screening children and adolescents for anxiety. The task force and the panel of independent volunteer experts that make recommendations on matters such as screening for diabetes and cancer also reiterated on Tuesday its 2016 guidance that children between ages 12 and 18 years should be screened for major depressive disorder. What you're seeing is that there has been the percentage of kids ages 16 to 17 have been diagnosed with anxiety has been increased from 5.4% in 2003 to 8.4% in 2011 to 2012. The article continues to kind of dive into what does this data look like today after the pandemic. And they're showcasing that more than 1 in 3 high school students reported experiencing poor mental health during the pandemic through June 2021, according to a Center for Disease Control Prevention survey of more than 7,700 students. About 44% said they have persistent feelings of sadness or hopelessness within the 12 months before the survey. The article really kind of dives into other places that we might need to consider to support students around poor mental health behavior or suicidal ideation. Like kind of dive into, I know there was some data here, I'm going to look for it for us around, the federal data showed that drug overdose among adolescents aged 14 to 18 nearly doubled to 954 in 2020 from a year earlier. Research from the University of California, Los Angeles found. Partial year data shows that this group is on pace to record 20% more overdose and deaths due to drug usage. If I dived deeper into this, a survey of a primary care physicians found that 76% believe the importance of taking adolescent patients about mental health. Talking about mental health would be important, but only 40% said that they always brought it up with the patients. The task force said. A lot's kind of going on around here, and obviously this is a big discussion. You saw in our conversation with Dr. Kathleen Walls that this is something we're looking at, and we even see that there wasn't enough evidence to make recommendations for against screening for suicide risk among asymptomatic adolescents. In a CDC report of youth mental health in the pandemic, about 20% surveyed high school students said that they had seriously considered attempting suicide in 12 months before the suicide. There wasn't also enough evidence to make recommendations on screening for anxiety of children younger than 8 and depression on children younger than 12, respectively. So you kind of see that data here is what I was reading out. So, what you're seeing that their schools are having billions of dollars to support kids and catching up with learning loss or just tutoring and getting grades. As we saw, most parents opt out on standardized testing. So schools are testing, seeing what are the gaps, what are the needs. But we really got to be talking about the mental health crisis in our schools and how this impacts kids. As now we're talking about anxiety, we're talking about depression and measuring that, having conversations about it, talking with students about it. So I'm going to tag this article as well, as it was pretty comprehensive and I threw a lot of data, and I know with a lot of numbers, it can be easily to not fully grasp what we're talking about here. But we're talking about serious things around students' overall well-being, not just economic well-being, but overall emotional and mental well-being. So we'll keep you kind of updated there, talk to more experts and see what we see. Check out the interview with Kathleen Walls around how to do SEL in schools for district leaders and infuse it into our curriculum. Really good stuff there. Thank you for watching ednews.com. We'll keep you posted.